Family day namin noon. Tapos nanood kami ng sine.
It was a usual family day for the married couple Daryl and Lay.
Tapos kumain kami. Tapos namin kumain, pag uwi namin, bigla na lang siyang nagsuka. Tapos nagtae.
Several hours later, Daryl felt nauseous and started to vomit repeatedly, which was also accompanied with severe headache. Daryl also had episodes of loose bowel movement.
At dinala ko siya dun sa mas malapit na ospital sa amin kasi nga suka siya ng suka. Sabi doon, meron siyang acute gastroenteritis dahil dun sa kinain namin. Binigyan siya ng antibiotic para sa tiyan para daw matanggal yung bakterya na nakain niya. After nun, mataas pa rin yung BP niya, mga nakaisang araw kami doon. Pero hindi pa rin ganun kaganda yung BP, tas laging sumasakit yung ulo niya. In-advise kami i-transfer siya sa ICU. Kaso ang problema, yung card niya, walang affiliated na doktor doon sa ospital na pinagdalhan ko. Kaya nag-desisyon na akong i-discharge siya, ilabas siya, at lumipat na lang ng ibang ospital.
Lay transferred Daryl to University of Perpetual Health Delta Medical Center, hoping that he will be managed there accordingly. Upon admission to ER, nurses and doctors assessed Daryl with a chief complaint of vomiting and headache.
Pagdating namin sa ER, inassess siya ng mga doktor sa nurse. Nakakakaba lang kasi naalala ko nung time na tinanong siya ng nurse kung ilang taon na siya. Ang sabi niya 17. Nagulat ako, inaaway ko siya. Sabi ko, bakit 17 ang sinabi mo? Sabi ng doktor, hayaan ko lang daw. Kasi i-assess pa nila yung asawa ko.
Okay, patient AK went to the ER to seek consult since he was previously diagnosed with acute gastroenteritis and hypertension in another institution. Doctors there prompted admission to the ICU. However, no doctors were accredited under their insurance, so they prompted to seek admission in our institution.
Duty ako sa ER nun, tapos may dumating na patient na iika-ika, tapos hinang-hinga din siya nun. Yung BP niya noon, 170/100.
A thorough physical examination was done to the patient. The general appearance of the patient was noticeably bizarre when it comes to his gait. However, he is not in cardiopulmonary distress. With a blood pressure of 180/100, heart rate of 70 beats per minute, a respiratory rate of 19 cycles per minute, and a temperature of 36 degrees Celsius. Upon inspection and palpation of his skin, there were no pallor, jaundice, cyanosis, skin lesions were observed. He has good skin turgor. He has anecteric sclerae, pink palpable conjunctiva, no palpable nodules or masses. Ears and nose are symmetric in position. There was no deformities, tenderness, and edema upon inspection on his upper extremities. Both were full and equal pulses. Upon inspection to his lower extremities, there were no deformities found. However, in performing Romberg's test, he was noticeably ataxic. Upon inspection and auscultation to his lungs, he has full symmetric chest expansion, there were no retractions, and he has clear breath sounds. His heart has normal rate and regular rhythm. There were no murmurs heard. His abdomen was flat, round, and symmetric in contour. Normal active bowel sounds were noted. He has soft and non-tender abdominal wall. Upon inspection to his rectum and genitalia, he has intact perineal skin and he has no abdominal discharges. The patient has a keen sense of smell. His pupils are equally reactive to light. His eyelid and eyeballs move accordingly to the four cardinal directions. His facial sensation is intact, has equal strength of temporalis and masseter muscles. He has symmetric face, he has no hearing loss, and has a midline palate. His shoulders shrugs equally and is able to push against resistance, and he has no tongue obstruction. He has a Glasgow Coma Scale of 15. His review of systems include loss of appetite, fatigue, nausea, vomiting, abdominal pain due to excessive vomiting. He has limitation of movement. He has ataxic gait. He has headache, dizziness, and restlessness.
After na nag-insert kami yung swera, tapos nag-save kami ng blood para sa laboratory test niya, explain din ni Doc yung regarding sa CT scan.
Nag-order si Doc ng CT scan. Nung una, parang wala lang sa akin. Kaso nung sinabi ni Doc na isi-CT scan na siya, natakot na ako, kinabahan na ako agad. Kaya pumayag na din kami agad. Tapos in-explain sa amin ni Doc yung results ng CT scan. Kinabahan kami kasi sabi ni Doc, may bara daw yung utak niya, may tubig daw. Tapos sabi nila, lalagyan daw siya ng tubo para mag-drain yung tubig. Akala ko nagsusuka lang siya saka nagtatay dahil dun sa kinain namin. Yun pala, iba na pala yun. Kaya mas maganda na din na nakita yun kasi kung nagsusuka lang siya naka nagtatae, baka hindi pa nakita ni Doc yung kondisyon niya talaga sa utak.
After nung CT scan, ni-explain din ni Doc na kailangan siyang i-transfer sa CV-ICU para ma-monitor siya ng mas maayos.
Tapos nag-advise na din yung doktor na i-ICU kami dahil nga dun sa kondisyon ng asawa ko. Tapos tumataas din kasi yung BP niya kaya pumayag na akong ipadala siya sa ICU. Nakakalungkot kasi hindi ko siya nakikita araw-araw doon. Tapos yung anak namin pumapasok din.
After the series of laboratory and diagnostic tests, Daryl was transferred from the ER to the cardiovascular intensive care unit.
Na-receive ko yung pasyente sa ER via stretcher. Medyo lethargic siya. Tapos mataas yung BP niya, 180-100. Transfer namin siya sa bed na naka-oxygen.
Tapos nung nasa ICU na kami, kinausap ako ni Doc na kailangan na talaga siyang lagyan ng tubo sa ulo. Explain din naman sa akin ni Doc yung risk nung procedure saka yung benefits. Winay ko naman, sa tingin ko naman is makakatulong sa kanya. In-explain din sa akin ni Doc kung bakit talaga siya nagkaganon. Kasi nung dati naman, okay naman siya. Nagulat na lang ako na meron pala siyang ganong kondisyon.
The brain is divided into three major areas. The cerebrum, which is responsible for the control of all voluntary actions. The brainstem, which plays an important role in regulation of cardiac and respiratory function. It also maintains consciousness and sleep function. Cerebrospinal fluid is a clear, colorless body fluid found in the brain and spine. It is produced in the ventricles of the body. It serves as a vital function in cerebral autoregulation of cerebral blood flow. CSF is produced in the choroid plexus, which is contained mainly in the lateral ventricle. It flows to the third ventricle via the intraventricular foramina, then to the fourth ventricle via cerebral aqueduct. From the fourth ventricle, the fluid passes through the subarachnoid spaces that covers the brain and spinal cord. Then it will be reabsorbed on the arachnoid villi in the superior sagittal sinus.
Stroke occurs mainly among those older than 65 years. but 28% occur in individuals younger than 65 years. Stroke incidence rates are 1.25 times greater in men, but because women tend to live longer than men, more women than men die of stroke each year. An increased incidence of stroke in families has long been noted. Potential reasons are a genetic tendency for stroke, a genetic determination of other stroke risk factors, and a common familial exposure to environmental or lifestyle risks. In the Framingham study, an offspring analysis revealed that both paternal and maternal histories were associated with an increased risk of stroke. Various lifestyle factors have been associated with increased stroke risk. These include obesity, physical inactivity, diet, and acute triggers such as emotional stress. Moderate and heavy levels of physical activity have been associated with reduced incidence. In recent years, evidence supports a protective effect of moderate physical activity on stroke incidence in men and women. Physical activity exerts a beneficial influence on risk factors for atherosclerotic disease by reducing blood pressure, weight, and pulse rate, raising HDL cholesterol and lowering LDL cholesterol, decreasing platelet aggregability, increasing insulin sensitivity, and improving glucose tolerance, and promoting a lifestyle conducive to changing diet. Increased consumption of fish, green tea, and milk were protective of stroke, while diets high in fat and cholesterol could be deleterious. Cerebral infarction results when an area of the brain loses its blood supply because of vascular occlusion. The permeability of the blood-brain barrier, which selectively inhibits certain potentially harmful substances in the blood from entering the interstitial spaces of the brain or CSF, is altered due to the lack of oxygen in the tissues. Fluids then accumulate in the extracellular spaces of the brain, resulting to cerebral edema. The increase in the intracranial content results to an increased intracranial pressure. Clinical manifestations that were present in the patient were nausea, vomiting, dizziness, and severe headache. With continued expansion of the intracranial content, the resulting increase in ICP may exceed the brain's compensatory capacity to adjust. Brain tissue shifts from the compartment of greater pressure to a compartment of lesser pressure. With this shift in brain tissue, the herniating brain tissue's blood supply is compromised, causing further ischemia and hypoxia in the herniating tissues. The volume of content within the lower pressure compartment is increased, exerting pressure on the brain tissue that normally occupies that compartment and impairing its blood supply. This causes blockage to the cerebrospinal fluid outflow in the ventricles, producing dilation of the ventricles proximal to the obstruction, which is associated with obstructive hydrocephalus.
Nung pagkakadiscuss niya, naintindihan ko naman siya. Kaya mas naging tiwala pa ako kay Doc na magiging okay yung asawa ko.
Nagpa-secure ako ng consent sa pasyente. Pinakausap ko yung doctor dun sa patient. Then, ayun, in-schedule na nila yung procedure. Then, dinala na siya dun sa operating room.